Hello, my name is Imogene Walters. I'm a grad student from attending Aspen, Colorado in Aspen University. And I'm doing my practicum at Mississippi College in Clinton, Mississippi. We're going to talk about spirituality today and nursing. The concept of spirituality is often confused with other concepts such as religion and faith. And although they are used interchangeably, they do not have exactly the same meaning. Spiritual is a word that comes from the Latin word that means to breathe. Literally, it means to breathe, and that phrase we use as a expression of being human or giving meaning to life. Christians and Jews may automatically think of Genesis 2:17 when they hear this. And the Lord God formed man of the dust of the earth and breathed into his nostrils the breath of life, and man became a living soul. However, those of other faiths may have other writings that are important to them. The word religion came from the French word meaning supernatural, a constraint, sanction, or even a religious practice. Again, in America, most of us think about Christians and Jews and the various subdivisions in those two major religions. And indeed, it has been a big part of our history in America. But today, many immigrants are coming to America who don't share those views with us. They have their own religion that they cherish. These include Muslims, Hindus, and others with different ideas about the supreme being that we call God. We also have people in our country who do not believe in God at all. We have the agnostics and the atheists. The atheists do not believe in any God, and agnostics hold to the view that if there is a God, he is unknowable. Faith is defined in the Christian Bible as the substance of things hoped for, the evidence of things not seen. Faith is defined by Webster as an allegiance to a duty or a person, a loyalty. It's a fidelity to one's promises, a sincerity of intentions, belief and trust in, and loyalty to God. It may also be the belief in the traditional tenets of a religion, a firm belief in something that has no proof, a complete trust, something that is believed, especially with a strong conviction, a religious belief, or a system of religious beliefs without question. Snyder's, Berman, and Fernandson define the concept of spirituality as the one that gives us the human experience to find meaning in life and purpose with others. A supreme being which may or may not be connected to the religious structures or traditions. Generally, these authors say that spirituality does indeed, most of the time, involve a belief with a higher power, such as God, Allah, the Great Spirit, or another higher power. However, they also point out that those who do not believe in a deity at all often find purpose in life. Some factors that identify, I'm going to move backwards. Some factors that identify spirituality would include a person's religious beliefs, their culture, transcendence, and family rituals. Where a person lives often influences their belief. For example, in Muslim countries, religion and the law are the same. They're one. In ancient Israel, it was also the fact that religion was the law. In America, the law and the church are religious beliefs, although very much connected in the beginning of our country, have become two entirely separated concepts. One is freedom of religion, and the other concept is the law of the land. The law, according to the Constitution, prohibits the making of any law respecting an establishment of religion or impeding the free exercise of religion. The culture of a person also influences their spirituality. Most cultures do believe in a supreme being. Specific beliefs vary as influenced by the beliefs of the people around us in the same culture, as well as family rituals which are related to religions. Transcendence is a state of being that is above the normal level of the human state. In nursing, when a person is experiencing intense pain, we hope to provide them with enough comfort to find another source of spiritual strength that allows them to overcome the pain that may not be relieved by any medical means, such as medication. So taken together, all of these factors identify spirituality. Some concepts that are related to religion include these: meditation, hope, faith, prayer, love, and inner peace. For nursing, we're concerned with the spiritual being of our patients, and we're concerned about their spiritual care, their spiritual health, and when they're in spiritual distress. Patients often find that spiritual needs involve others, and they feel relieved if they are able to forgive or ask for forgiveness. The patient may need to find personal gratitude for the blessing he or she has received, and they need a focus, a vision for better things to come, or in preparation for death with the hope that pain will be ended and eternal peace may be found. On occasion, the nurse may find the patient's need to cope with the death of a loved one, or if a patient is facing death, the family will need spiritual support as they try to cope with the impending loss or the death that has occurred already. How does illness affect spirituality? Well, it can be due to interference in our daily pattern of living. Muslims need to face Mecca, for example, and others may need to turn their face in a different direction, to a different part of the world. Prayer may be hindered. Some believe that a certain posture is necessary. I think I'm off that. Some believe that a certain posture is necessary, such as kneeling or bowing all the way to the floor, for effective spiritual prayer to take place. Older Catholics may also have dietary concerns. I think I messed up on my slides. Let's go back. Older Catholics may also have dietary concerns. They may wish to abstain from meat, except for fish, on Fridays, in respect for the day of the week on which Christ died. So what are we assessing when we assess? Questions that you may ask are related to the acronym FICA, which is for faith, implications, community of like beliefs, and addressing those beliefs. Questions you can ask are, what are your spiritual beliefs? Which ones are most important to you? Are there any special needs you may have that you need to meet your spirituality goals? Would you like someone to call a pastor, a priest, or another spiritual leader to help you with your spiritual needs? Any problems revealed can then be included in the care plan for the spiritual aspect of care and addressed. Implementation of the plan begins with interventions that are needed and may include communication with the dietary department, calling a spiritual leader to assist the patient, alteration of the medical plan, encouraging memory of past coping skills in similar circumstances, or providing a place for prayer and worship. The nurse should be actively present in the room with the patient in mind and spirit. Active listening is very important. The role of nursing in spiritual care is likely to continue as long as the nurse is caring for the patients. Expressions of fear, hopelessness, or conflict between the medical plan and the religious convictions of the patient are real possibilities. The patient may ask his or her nurse about his or her personal beliefs. So, can a nurse share her own religious beliefs with the patient? Well, the answer to that is yes and no. Before the nurse does that, she needs to ask some questions. Did the patient ask the nurse to share her personal beliefs? If so, the nurse needs to determine the reason behind the question. If it is truly clear that it would be the patient who benefits, not the nurse, she may share her personal beliefs. However, the nurse may also refrain from sharing her personal beliefs because it is a personal question that she may not feel comfortable answering. So, you can, but be sure it is in the interest of the patient and not the nurse. For healthy promotion of spirituality, we must determine the patient's spiritual beliefs. We must support those beliefs. We must advocate for those beliefs. And we must allow their religious symbols in the room. Some do nots. Do not impose your own beliefs. Do not share beliefs if you have not been invited to do so. And do not say everything will be okay. We do not know that everything will be okay. Instead, it would be better to say, tell me more, or how can I help you with this concern? Don't attempt to fix spiritual problems. You may offer a spiritual leader of their same faith who can help them with that. Patients may appreciate a meaningful poem. Religious reading of the patient's preference may be used. Some inspirational or soothing music of the patient's preference may be helpful. Here in the South, in Mississippi, I work in a nursing home with older patients who are all Christians as I am. I find it helpful sometimes when I'm giving my care, especially to someone who's just has a little bit of dementia, that when I'm doing something that's they find objectionable, but I have to do it, such as changing a dressing, I'll often sing to them some of those old spiritual songs that they grew up listening to. And usually they forget about what I'm doing and they start listening. So we can use our spiritual gifts as a ministry when we know that it's in tune with what the patient does, and if it does benefit them. And in my case, it does benefit them because it takes their mind off the pain or the procedure that I might be doing. If you are asked to pray by one of your patients, ask for specific needs to pray about and be sure that you request those specific needs the patient has asked you about. If you're uncomfortable praying with the patient, you don't have to. It's good to use creativity to create happy memories. Use humor if that's your gift. If not, you might want to just ask the patient about their interest. And if you do use humor, make it unrelated to the patient's condition. If patients don't mind, a gentle touch is healing. Reflection and memory walls of past experience are often helpful for patients. Remember, your presence is comforting. Sometimes all they need is for you to sit there and listen, or just be with them in silence and support them. You can do active listening while you're providing the care that you must do. And those are the references that right there. So I hope that you learned something today, and I hope that you'll think about spirituality when you're taking care of your patients. Thank you.